Guten Tag, and welcome to the weekly educational rounds here at Sinclair. My name is Jim Ellermeyer, and I'm a behavioral health therapist here, and today I'm joined by my colleague,
Britta.
And Britta is
I'm an athletic trainer, but I'm also a physician-assisted student at Chatham.
And on my right would be...
I'm CJ. I'm a PA student from St. Francis University.
And today we're fortunate to be joined by Bob Jansch, who's director of the Pittsburgh School of Massage Therapy. So Bob, thank you so much for joining us today. And could you give us a little bit of your background and what you're involved with down there at the school?
Well, the Pittsburgh School of Massage Therapy is the only school in southwestern Pennsylvania that's devoted exclusively to massage therapy. And I got into this by wanting to get involved with a helping profession, and yet I wasn't willing to spend the time necessary for other programs, other professions. And after getting involved in the profession, I realized what benefits massage has, how important regular, structured touch is to people, and I just love doing it. So even though I'm the director of the school, I maintain a private massage practice also.
Well, and there's few things worse, Bob, than going to a job every day you dislike. Few things. I'm glad to see that you enjoy what you're doing. Give some joy to your life.
Yeah.
Wonderful. And here at Sinclair, we're more of an integrative, holistic type of integrative psychiatric facility. And quite often when an individual comes in, they often present with depression, they often present with anxiety, some other related disorders, and rather than paint a person with a broad brush as anxiety or depression, we tend to take a holistic view of their environment, their social, their nutritional, their sleep, everything that goes on that makes them tick, that affects their world. And one of the modalities that we often recommend here is massage. Could you talk about your experience with massage and dealing with depression and or anxiety, Bob?
In my practice, most of the people who come to my practice and most people who come to massage therapy seem to come for two reasons. One is stress and the other is pain reduction. Both of those would be helpful in reducing it, from my understanding, would be helpful in reducing anxiety and depression. There's been some research on anxiety and depression and how it's benefited the reduction of anxiety and depression through regular massage therapy. So many things are related to stress, and a regular massage is one of the greatest stress reducers you can do.
Sure. And some of the patients that we deal with here, Bob, are here for assistance with narcotic dependence that have developed from a type of injury that they've gone to a doctor for, they've gotten them on opiates, and found that it's very difficult for them to get off of them. And we're always exploring different options for individuals in dealing with pain. And I'd be interested to hear what you have to offer on that.
Well, that's another thing that there's been a lot of research done, is using massage in recovery, both from drug addiction and alcoholism. Massage releases serotonin. The release of serotonin assists in people's cravings, reducing the cravings for whatever substance it is that they've been abusing. So it's been found to be very helpful in recovery programs, massage therapy.
And we deal with individuals. We certainly can help them with the narcotic dependence through some of the practices that we do here, such as yoga, mindfulness practices to deal with the pain. Quite often we refer folks out to acupuncture and massage. I've found that massage therapy seems to be particularly effective.
That's what the research says too, so it's great you're doing that.
Well, great. And today, like I explained before, Britta has a background in sports medicine, and quite often what we find here at Sinclair is that people's emotions, feelings, the anxiety, the stress manifests itself in certain parts of people's bodies, Bob. I'd like to maybe perhaps if you could address that a little bit.
Well, anytime you have a you can't, as you're well aware, you can't separate the mind and body. So whenever there's a psychological issue or a stress issue or a problem, emotional issue, it manifests in the body. It shows up in tension. I don't know that there are specific areas related to specific emotional difficulties. There are some systems that say there are, but it's just, well, the thing that I relate it to is the idea of muscle memory. A lot of times when we have students starting at the school, they'll be getting more massage than they ever got before, and reducing the muscular tension, working on specific areas of the body, will often release the emotional issues from past events. So students going to massage school or massage therapy clients who start getting regular massage will often think back to traumatic events or pleasant events or things that were really strong for them emotionally that are related to a particular part of the body. And they often wonder, why am I thinking about this? Why is this coming up now? Why am I remembering was embarrassed in front of my class in kindergarten? It's just something that you don't really expect, but it happens a lot.
Yes, I've been trying to explain to Sven for a long time now what a pain in my neck he is, and but I haven't been. Perhaps I should come down and see you. Maybe you could work that out. And I'm going to ask Britta in her sports medicine career is associated with muscle memory. Perhaps you could address something to Bob on that, Britta.
Not so. Are you saying it's muscle memory in terms of what? I guess I'm like where they store the stress or where they store the tension or certain muscle groups based on certain types of stress? Is that what you were referring to?
Well, more comes when there's a physical injury associated with the traumatic event.
Okay.
Is what happened. So I remember when I got Rolfing, which is a very extremely deep form of massage. They work on the face, and as I was having them work, they actually work inside the mouth when they do Rolfing. And I was getting the massage, and I was taken back to being in the orthodontist chair and gagging out stuff that the orthodontists used to make the molds. That memory came back, the taste came back, the feeling of having Novocaine in my mouth came back. And that can happen in all sorts of different areas of the body. If there's some injury to the leg, working on the muscles in the leg will often bring back the memory of whatever traumatic.
Oh, okay.
Well,
Thank you.
Well, quite often in Western allopathic medicine, Bob, people are looking for a magic pill. They're looking for something to make them well right away. And of course, we deal with the physician's assistants here are training in a career primarily in allopathic medicine. However, I'd like to ask CJ if it's in his training if they've ever tried to introduce other enhancements, other modalities such as massage therapy.
Like, do you mean for past experiences?
In your training that you're having with the physician's assistant.
What about that lady?
Other than here, not really. Like in school, we didn't really talk much about other ways of seeking treatments. It was mostly with like the farm, like the magic pills and stuff. But since I've been here, saw many different things. Do you remember what that was?
I don't remember what that was called, but it was like the change of your energy.
The polarity.
The polarity change.
We work with polarity.
Yes. We have a lady here by the name of Renee who does some energy medicine work with us, Bob. Do you deal anywhere with the energy channels in the body with your massage?
The way you ask the question, do I deal with it? Every time somebody's touched, you're dealing with that. Do I do a specific work myself that is meant to enhance the energy flow? No. At the school, we do include Reiki as part of our program because it's so important for massage therapists who are being trained to recognize the physical body and the energetic body. And as far as the idea of working with massage in medical centers and in medical training, there are so many, not Pittsburgh necessarily, but there's so many medical schools that are starting to include complementary alternative medicine as part of their program. Duke Medical Center is one that comes to mind.
This is rather unusual, but I have a patient, Bob, who works at a large distribution warehouse, and they do a lot of really physical activity, and they're really on the clock. And this company apparently thinks so much of their employees that they employ a massage therapist full time to deal and help the employees out during the workday.
That was growing for quite a bit. It's with the crash of the economy, it sort of was reduced a little bit. But it's so helpful in increasing efficiency in the workplace. If the studies had gone out, if the studies were really known by the corporations, they'd all be hiring massage therapists. The one that I can think of offhand is a study that was done that showed that people who received a 15-minute chair massage weekly, it did mathematical calculations as part of their work. The number of errors was reduced dramatically, and the speed also increased pretty dramatically through the introduction of therapeutic massage in the workplace. So just imagine what effect that would have in an area where there's a lot of physical movement and a lot of physical stress.
So I would like to extend, on behalf of Dr. Chaudhary and Seclair, I'd like to extend an invitation to you and any of your staff and students who would like to visit us out here at Seclair, come out into the country a little bit for a little bit of mindfulness. And how could an interested individual get in contact with you, Bob?
Well, the school's website is www.pghschmass.com, or they can call 800-860-1114. That's 800-860-1114.
And also, from what I understand, Bob, that on on December the 3rd, from 9 to 10, you're going to be a guest here at what we have the Grand Rounds here at Seclair, where we have an opportunity for the public and staff to come in and get some education, and we're looking forward to seeing you then.
Yeah, and I'm looking forward to going out, seeing your facility, meeting you, and having a little talk about how massage can work with your holistic medicine center.
That'd be super. I'd like to avail myself of your services, Bob. Yeah. And any other comments from my colleagues, Britta, CJ?
Just to continue this conversation, please like us on Facebook, Google+, or follow us on Twitter under Seclair Life. And keep an eye on any of these for our next live recording Monday around noon to ask your questions. You can also find this and other Ground Rounds on youtube.com/Seclair video, and find audio versions on iTunes, Stitcher, Speaker, and iHeartRadio. And please visit www.seclair.com for more information about us and articles on our great blog.
And if there is a magic prescription, we're going to write you one today for fruits, nuts, and vegetables. Perhaps unplug your television and take up fishing. And Sven and I usually appear every week at a comedy hour, and we call it Fishing Without Bait. So until next time, please be good to yourself, and thank you for joining us today. Thank you, Bob.
Thank you.